everyone. Dr. Adriana Popescu here with you with another episode of Triumphing Over Trauma, our inspirational and educational video series. And I have a familiar face back with me today. She was once a guest on the podcast that I have, Kaleidoscope of Possibilities, and I'm so excited to see her again. This is Julia Blackwell. She is a fascia release practitioner, educator, and creator of the fascia remedy. After years of debilitating pain and mobility issues, she developed her own healing modality and has been able to solve her issues as well as help others quickly alleviate pain, restore movement, and perform at their best, earning her the nickname the Pain Relief Wizard from her community of both professional athletes and everyday movers. Welcome back, Julia.
Yay, so glad to be back. Thanks.
Yeah. So tell us a little bit about your experience of trauma and how it inspired you to do the work that you're doing now.
Yes, well, it literally started the day I was born. Whether or not you can believe it, I was almost a 10-pound baby. And in the process of being born, I got stuck. So, in a very quick and intense effort to get me out, the doctor ended up stretching and tearing most of the nerves in my right shoulder. And as far as I know, that initially rendered my arm essentially useless. I did have a pretty massive nerve regraft surgery when I was only 4 months old, where they took nerves out of the back of my legs, specifically my calf, and then rerouted them in my shoulder. Which, if you think about how tiny a 4 month old baby is, it's still wild to think about to this day. Uh, but as helpful as that surgery was, it did help bring my arm somewhat back online, if you will. It still left me with a lot of limited mobility, limited strength, and really a feeling of being incredibly uncomfortable in my body. It took me a long time to discover that's the feeling that I was feeling. I thought it was simply anxiety growing up, as many of us have likely experienced as well. But it was a real challenge. I still wanted to try sports. I still wanted to try different modalities to see what might help my arm. But ultimately, every doctor and practitioner I went to growing up told me that there was nothing that could be done for it. And if anything, it was going to get worse. So there were varying degrees of things said to me. I had a doctor once tell me I would never play sports. I had someone tell me that there really wasn't a point to doing much stretching because nothing was ever going to change. Just a lot of insane definitive things from people over the years, I can tell you that much.
Wow.
Despite that, though, I was obsessed with anatomy and physiology, so I still learned as much as I could about the body. Are you hearing a echo on your end? Sorry to interrupt here.
No, I'm not. Mm-mm.
Okay, I just heard some feedback. Okay. Woo! I'll
Nope.
keep going then. We'll just have to edit that out. I was like, "Oh
Yep.
no."
No worries. No, I'm not hearing anything. Is it still there?
No, now it's not. It just was like a 5-second thing, but it threw me for a moment. Okay.
Okay. So anatomy, physiology, learned about bodies. That's where we were.
Yes. So I moved out to Boulder, Colorado in 2010 after I graduated from college in Ohio. And by some beautiful, amazing, fateful chance, I met this lady who did a very specific type of fascia release work. And I'd heard of fascia. It was very briefly mentioned in my college level education, but very briefly. It was labeled as connective tissue. It attached things together, and then we moved on. So I didn't know much about it, but I thought, I'll give it a go. I had tried as many modalities as you could probably name off the top of your head, even though nothing had previously given me any type of lasting relief. But after just one session with this lady, I knew that fascia work was different.
Mhm.
It was about active movement and asking my arm to engage in a way that no one ever told me I could, or they just didn't bother to require me to do. So I really had spent so much time disconnecting from my body and accepting what was there and really pretending like it wasn't attached to me. Truly. So, this was a really interesting way to talk to this communication system and this specialized tissue that suddenly was giving me emotional releases. It was suddenly allowing for more mobility to happen in my body. The muscles started firing for the first time. It was a really incredible experience. And truly, I saw more results in the first 3 months of doing fascia specific work than I had in an entire lifetime of
Mhm.
doing traditional treatments and going through the standard Western medicine system.
Mhm.
So naturally, I became obsessed with fascia. I wanted to learn everything I could about it. And the more I learned, the more it opened up the possibility for healing. And, my arm is still in its healing process. I still have limitations. But for something that was supposed to be completely permanent and not changeable in the least, I have come an incredibly long way. Again, I have muscles that fire now. I can rock climb. This last August, I actually finished a 12-year long journey of hiking all of the tallest mountains in Colorado. There are 58,
Wow.
and I finished that this August. So, yeah, that would have been certainly something I considered, my arm a liability. If you would have told 15-year-old me that I was going to be a mountaineer and climb all these mountains, I would have thought you were crazy. So I've really been able to come so far with the progress I've made, but also, the progress I've been able to see with so many other people because I learned how to do this body work for myself. I learned so many other fascia related modalities. I've developed my own systems and methodologies for understanding where pain originates and how we can interrupt these really stuck movement patterns and get stress and trauma out of the body. So it's been a really cool process, not just for myself, but I think teaching these skills and these tools to other people has been really important in not only helping those people find healing for themselves, but it's also healing for me to help them.
Yeah, what an incredible story. I think so many people, I really want to highlight how so many people have been told by doctors, people who have chronic pain issues or even an illness. I had Lyme disease for 20 years and they told me, "Oh, you'll never heal from this. There's no cure for this," right? And how traumatic that is. I mean, it's a sentence, really. It's like it's saying that you'll never live a healthy, like fulfilling life, and it's just not true in many cases. There is so much more out there that people don't even know. Holistic therapies, outside of the Western kind of treatment paradigm. I think there's so much for people to explore there, and so I'm so grateful that we're talking about this. And then I love the symbolism of like climbing the mountains, because truly you had to overcome huge mountains to get to where you are today. What were some of the hardest parts of that for you?
Well, I certainly was not expecting the emotions that were going to come up during my healing process,
Mhm,
especially ones that I know I've been carrying literally my entire life.
mhm,
So, one of the first times I had my neck worked on near where this really amazing, crazy scar is on my neck, where I had that nerve regraft surgery. It was so gentle and light pressure. It was not hurting me physically at all, but suddenly tears were streaming down my face. And I had no clue what was happening and had to be told, like, this is trauma in your body. It gets stored in your tissue. It can and has to come out of your body for you to feel better. And I think that was hard. I spent so much of my younger years persevering.
mhm,
I pushed through things. I didn't like to tell anyone if they didn't notice my arm. I didn't like to share about it. I like to stay in a small, limited box where I could keep my emotions in check and not do anything too scary. And so it felt hard at first to be getting waves and waves of emotions as I was working through this tissue, but it was one of the most highly rewarding parts of this as well. I have had people close to me, even my dad, tell me that they're almost surprised about the person I've become and who I am now. And I think a big part of that is so much of the emotional blockage I was experiencing through a physical problem had to
Mhm.
move. There's still stuff in there. The healing journey is never done, but that was
Mhm.
really hard for sure. And a lot of it was the mental game of untangling those words that you have heard from a person in a position of authority, like we were just talking about. It's really difficult at first to figure out what's someone else's belief and what's yours. So I had a lot of things in my head of like, you can't do this, or, oh, you're going to get hurt. You're too fragile for this. All of these things that I had been told over the years. And
Delivery man.
there's the Amazon. I was like, oh, it's going to happen.
Mhm.
Okay. But I do think I had been told enough things enough times that I had to consciously start collecting evidence that these things were no longer true. So we have a system in our brain called the reticular activating system. You may have even talked about it on this podcast before, where whatever we believe to be true, our brain starts looking for evidence that
Mhm.
you're correct. We all love being right. But it could be as simple as, you decide you want to buy a red RAV4 and then suddenly you see them everywhere because your
Mhm.
brain is looking for ways to validate what it is that you're thinking. And so I had to spend time validating that I am capable of doing things. I am healing every day and improving and finding these ways to celebrate the wins, no matter how small, when it was great evidence to show that this old way of thinking that someone else told me is not actually true.
So important. And I think it also really clarifies for us how important it is to look at healing from trauma. It isn't just about like physical healing in your case or, emotional healing in maybe someone else's case, but that there are physical, mental, emotional, and spiritual aspects to any trauma. And that all of them, because it affects us in all of those areas, and so to heal from trauma, we really do have to look at all of those aspects and do some work maybe in each of those areas. So I'm curious, what helped you then, or what still are you doing today that helps you stay strong and resilient and continue your healing journey?
Well, I've made a commitment to myself for myself to work on my physical body because I believe that one of the fastest ways to your brain and to your mental health is actually through your body. There's no way that we can separate that mind body connection. And a lot of times we like to live from the neck up and think our way through everything. And if we can spend more time being in our body, feeling grounded, feeling what our tissue feels like, going exploring and seeing what's tight, what needs work, what intuitive hits are you getting, there's an incredible world on the other side of that, understanding your body better. So I, you know, have had aches and pains in the last 15 years since I first discovered fascia work. Pain is a part of life. Sometimes you wake up with a crick in your neck, or sometimes I go up the stairs and suddenly one knee starts hurting. But because I have dedicated so much time to understanding my body and working on my fascia and breathing through it and creating a lot of safety through sensation, I'm no longer afraid of pain.
Mhm.
Whenever something pops up, I will be like, oh, I must have some extra tension in my calf right now or my IT band. I'm going to go work on those things. And that's an incredible skill set that I still do. I still work on myself all the time. Thankfully, in the last couple of years, I started training other practitioners. And so now I have at least one practitioner that can work on me when I'm not just doing self release on myself. I think that's been one of the most valuable things. It's just the dedication of even if it's 2 minutes a day. And Most of the time, it's at least 10. But even if it's just 10 minutes a day, I still have made that commitment that this is my life. There's no stopping. There's no point where you're like, okay, I'm done now.
Yeah, yeah. It's ongoing.
Unfortunately, that'd be nice.
Yeah.
But
Um,
that's been my main focus. Yeah.
yes, yes. Okay, so if you were encountering someone who's in the middle of it, right? Like you've kind of come out the other side of a very dark place, but for the person who's still struggling and maybe isn't seeing the light at the end of the tunnel yet, what would you say to them?
Well, especially to those who are experiencing chronic pain or they have some kind of physical limitation that someone has told them is going to be there forever and that'll never improve. I really would encourage you to be open minded and try new things. Try things that seem crazy. Try them that are far beyond the Western medicine scope because I had to go to something that was pretty out there and it completely changed my life. So many people that I see, even to this day, fascia is becoming more of a buzzword these days. But so many people that I work with still don't know about fascia. And fascia doesn't show up on an MRI. So if you have really tight, restricted, dehydrated tissue, maybe you went and got an MRI and they said, well, everything's fine. And they maybe it's fibromyalgia, maybe it's, chronic lower back pain. It's something that no one can find a structural reason why it's happening or they don't know why. It's likely fascia. And the main thing is realizing you may just not have found the place that it's originating or the root cause of why it's happening. Just because your lower back hurts, in fact, it's really unlikely that it's your lower back that's the problem. There's
Yeah.
likely so much fascial tension through places you may not realize, like the adductors or your core muscles or the quads. And most of us are taught, well, hey, stretch your hamstrings more or stretch out your back, go get massages on your back. And if you're not seeing any lasting results, it's okay. Try somewhere else. Have someone help you find other places to go find the root cause. Maybe it's emotional. Maybe some somatic exercises are about to change your life. There's just so many things that are available to us now that I just encourage you not to accept whatever intense or definitive diagnosis that you may have received because it might just be that you haven't found the right thing and you haven't worked in the right spot.
Yep. Really wise words there. And we talked a lot more about all of this in the original podcast we did together. So I'll add a link to the show notes for this episode for people to find on episode, I think it was 101 of Kaleidoscope of Possibilities, where we had a much longer conversation about this. Julia, if people want to find out more about you and your work, where do they go?
I would recommend you head over to my site. It's thefasciaremedy.com. Fascia is spelled Fascia. And on thefasciaremedy.com, there is a free 3-day video series called Unlock Your Hips. And if you're interested in understanding more about the unique way that I teach people to release fascia, and if you want a really quick way to experience the difference of releasing that way for yourself, you can download that series on my site.
Wonderful. Thank you so much for sharing your story with us. And if you've been watching this video and you think you know someone who might benefit from this information, please do pass it on to them and be sure to subscribe to the channel and do all the things that will help us get this information out there in the world. Thank you, everyone. Thank you, Julia.